We're just days away from finding out who will serve as Scotland's next First Minister, and alongside them, a new Health Secretary will face the monumental task of repairing a national health service that's stretched to breaking point. NHS Scotland continues to buckle under the post-pandemic backlog, and weary healthcare professionals are rapidly losing faith in their ability to sufficiently treat the population. 65% of A&E patients waiting beyond the 4-hour target, more than 6,000 unfilled posts across Scotland, dentists reducing NHS treatment or walking away altogether. Scottish Labour leader Anna Sarwar believes that the very survival of the NHS is at risk in Scotland.
We have a National Health Service that was challenged pre the pandemic. Of course, the pandemic has exacerbated a problem, but we shouldn't pretend it created the problem. On every single measure, our NHS is weaker now than it was even a year ago, never mind 3 years ago. Now 770,000 people on an NHS waiting list. Our CAM stats, the worst that they have ever been. Our A&E stats, the worst they've ever been. Our cancer waiting times, the worst they have ever been. And right now we've got a government that wants to put its head in the sand rather than confront that big crisis facing our NHS.
That crisis is forcing NHS dentistry to the brink of collapse. More than half of Scottish dentists have already reduced their NHS treatment, with 83% planning further service reductions over the coming year. Chairman of the Scottish Dental Practice Owner Group, Dr Ataf Bashir, says it's time for the Scottish Government to do more than just pay lip service to their concerns.
The first thing that needs to happen is we need to go from a disease-centred model to a preventative-centred model. So that's the first thing. They need to start to listen to the profession and then take action based upon what the feedback is. But certainly what the feedback is unanimously is that this current system needs to change because it's not fit for the Scottish people.
Let's be clear, the NHS is not beyond repair. In fact, the last few years there's been many a story which paints the service in a good light. We saw the Scottish Government oversee the fastest COVID vaccine rollout in the UK, and they acted quickly to resolve a pay dispute with doctors and nurses to avoid any industrial action. It's just that right now, poor performance outweighs those achievements, and there's a growing sentiment that both patients and staff deserve better. So whoever emerges as First Minister, the pressure will be on from day one to drastically improve the way healthcare is managed here in Scotland.